Hi, this is Dr. Marty Klein with more sexual intelligence. Do you think of yourself as bisexual or asexual or some other sexual? I can easily understand why someone would want a simple answer to what's my sexual orientation or identity. Now, I provide case consultations for many therapists each month, and questions about sexual identity and orientation are not unusual. For example, Marty, a client wonders if she's bisexual. How do I help her decide? Or, Dr. Klein, a patient thinks he's asexual. How do I evaluate this? Much to the surprise of my colleagues, I often say that they and their patients might be asking the wrong question. Many therapists say that labels such as bisexual, demisexual, asexual give people permission to finally be who they are. But I say these labels are an inefficient route to self acceptance and are ultimately more limiting than freeing. People don't need an identity to justify their preferences, and people don't need an identity to accept that what they do or want is normal. I'd rather they decide that normal is irrelevant. Now that would be real growth. How do I discuss this with patients? I ask a lot of questions. I often say what I just said. Generally, my goal is to validate people without reassuring them. This is a clinical tightrope, but it can lead to the deepest growth. Take Alice, for example, wondering if she's bisexual. She doesn't need to decide this, I told her therapist. She only needs to decide if she wants sex with a particular person at a particular time. And she can give herself permission to fantasize about sex with absolutely anyone without deciding who she is or what erotic team she belongs to. Indeed, if Alice wants to sleep with individuals of many genders, that still doesn't mean that she's bi or pan or whatever. Maybe she doesn't want to sleep with men, but rather with Joe. Maybe she doesn't want to fantasize about women, but about Jackie. But, said her therapist in our case consultation, Alice wants to know if she should be open to both men and women sexually. Knowing whether or not she's bi would make that a lot easier. Plus, continued her therapist, it would help explain or challenge her difficulty in her current marriage. Now, her therapist is right. With a defined sexual orientation, Alice could lean on a category and let that fact guide her decisions. By contrast, it would definitely be more complicated for Alice to decide what or who she wanted without such a crutch, to not give her desire a name, to just be and accept whoever she is. And rather than confronting her issues about commitment and autonomy, a pattern which the therapist had already observed, it would be far easier for Alice to say, I'm bi, and therefore I can't be expected to be monogamous, rather than working on this emotional deficit. Now, her therapist does know that plenty of bisexual people are happily monogamous. I know that too. Most therapists know that. This is a perfect example of how a category can make short-term decision-making easier, but limit long-term growth, even medium-term self-honesty. Now, let's move on to Sam, the possibly asexual guy. I could tell Sam's therapist everything that's wrong with the popular new category asexual, that there's no agreement on a definition, that it organizes people based on what they say they don't want, that it assumes that some version of sexual attraction is normal, that there's no differential diagnosis regarding medication side effects or rage or fear of intimacy or mental health issues like bipolar disorder. And the category invites people to feel aggrieved when there's absolutely no discrimination against them. A raised eyebrow is not quite the same as losing your job or being beaten up. Or I could tell Sam's therapist that when people say they're asexual, we have no idea what they mean by that, which is also true. But there's an even deeper point here. In talking to Sam's therapist, I referenced the same principle that I used with Alice's therapist. It's not necessary to decide which team somebody is on. Sam could say, I generally have a low sex drive. He could say, I'm in a non-sexual part of my life right now. He could even say, I'm not in the mood to have sex with you right now. He also has the option to say, and please don't ask me again. And if Sam or any other patient tells their therapist, but I want to know. I want to understand myself better. I want to make lifestyle decisions. You have to help me decide my orientation. Then what should the therapist do? At least in principle, most therapists agree that encouraging patients to explore their emotional desires is better than simply gratifying the patient. When patients tell us, directly or more often indirectly, that they want to be admired or pitied or loved or to feel special, it's generally more helpful to them if we discuss their feelings rather than reassuring them or giving them what they say they want. So when Sam or any other patient says that they want a category or a formula to make their life simple, I totally sympathize, but I generally don't provide one. Instead, I encourage patients to talk about this desire, and I invite them to talk about their frustration that life isn't simpler, which is not the same as people whining about their lives, by the way. So this is how we can empower people, helping them to talk about how they want to feel seen, how they struggle to make sense of a complicated world, and how they yearn for community. We accept people as they reveal what may feel to them like weakness. We connect with them even as they feel disconnected from others or even from us. In response, people often find themselves rising to the occasion as they realize the necessity, and therefore they find the strength to comfort themselves, to grow beyond mean-spirited family members, to make more conscious decisions. We do this all without telling patients, "You're great," which they should have been told repeatedly when they were 8 years old. And we do this without predicting which sexual identity's community will welcome them. I'm Dr. Marty Klein. Thanks for joining me for some sexual intelligence today. By the way, you can also find me on Instagram, where you get sexual intelligence one sentence at a time.